Orthopedic surgeon warns after 70. Walking is not enough. Do this exercise instead. Senior health advice. The World Health Organization estimates that every year around 37 million serious falls happen across the globe, and adults over 60 are the ones who suffer the most. In many developed countries, a hip fracture after a fall becomes a turning point. 20 to 30% of older adults don't survive the first year because of complications and the sudden loss of independence. And if you look at data from organizations like the International Osteoporosis Foundation, the picture becomes even clearer among people over 50. 1 in 3 women and 1 in 5 men will experience an osteoporotic fracture at some point in their lives. Across clinical studies in the US and Europe, researchers keep arriving at the same conclusion: regular strength training can cut fall risk by 30 to 50% and even a modest increase in bone density. Just a few percentage points in the hips and spine over 6 to 12 months can dramatically reduce the chance of a fracture. That's why the official guidelines in countries like the United States, Canada, and the UK all emphasize the same message: walking is wonderful. But if you're over 65, you also need strength-building exercises at least 2 or 3 times a week. When I share exercises like sit-to-stand heel raises or step-ups, it's not because they sound good. These movements are used by rehabilitation physicians, geriatric specialists, and osteoporosis organizations around the world in their fall prevention programs. And I've watched them transform the balance, confidence, and independence of so many of my patients in their 70s and 80s. You have every reason to believe that with consistency you can experience the same changes. And to help you feel more secure applying what I teach, let me be clear. This isn't just the personal opinion of one doctor. Everything I share is grounded in hard numbers from major international organizations. You might think that walking every day is enough to keep your bones and joints strong after 70. As an orthopedic surgeon who has spent 3 decades caring for older adults here in the United States, I have to tell you something. Honestly, walking is great. But after 70, walking alone simply isn't enough. Every week, I meet 72, 75, even 80-year-old patients who walk 5,000 to 8,000 steps a day, and yet they still end up with a hip fracture after a small slip in the bathroom or a missed step at the curb. The problem isn't that they're inactive. The real issue is that they've been missing the single most important type of training that protects them from falls and keeps their bones safe. 1. The story and why walking isn't enough after age 70. Let me tell you about John, a 74-year-old patient I remember vividly. Every morning, he walked around his neighborhood for 45 to 60 minutes, counting his steps with almost perfect consistency, about 6,000 to 7,000 steps a day. He didn't smoke, he ate fairly well, and he truly believed he was doing the best thing for his bones, joints, and heart. One evening, as he stepped into the bathroom, a small patch of water on the floor caused a slight slip. It wasn't a dramatic fall, no major impact, no heavy collision, but when he arrived at the hospital, we discovered he had fractured his hip, one of the most dangerous injuries for older adults. He looked at me and asked, "How is this possible, doctor? I walk every single day." The truth is, after 70, the question isn't whether you're active. The real question is whether the activity you're doing is strong enough to preserve your muscles and bones. Walking does wonderful things. It supports your heart, helps lower blood sugar, and boosts your mood. All of that is true. But for bones and muscles after 70, walking alone often isn't enough force to maintain what you need for stability. Every year, your body loses muscle mass and bone density, a process known as sarcopenia and age-related osteoporosis. Studies in older adults show that walking by itself barely improves the strength of the legs or the glutes, while strength training can reduce fall and fracture risk by 40 to 60%. And the reasons are very clear. Walking doesn't activate the gluteus medius strongly enough, the muscle that keeps you stable when you step sideways or catch your balance after a stumble. Walking doesn't create enough compressive load on the hip and thigh bones to prevent continued bone loss. Walking doesn't train your body to react within the crucial 0.3 to 0.5 seconds when you slip or trip. This is why so many people like John Tata, dedicated walkers, still end up falling and fracturing a bone. In the next section, I'll show you the specific exercises that take just 10 to 15 minutes a day but give your bones and joints far more protection than walking alone ever could. Don't leave the video yet. This may be the knowledge that keeps you out of the hospital after just one small slip. Exercise number 1, sit to stand, the strength test of old age. I often tell my patients, after 70, the simplest way to measure your real strength isn't how many steps you walk. It's how many times you can rise from a chair. Mary, a 72-year-old woman, came to see me because she was terrified of falling. She said, I walk around the house every day, but every time I stand up from a chair, my legs feel weak and I get lightheaded. So we did a very simple test, 10 continuous sit-to-stands without using her hands. She managed 4, then had to stop because her thighs were burning and she was out of breath. Research in older adults shows that those who cannot complete 10 sit-to-stands in 30 seconds have a significantly higher risk of falling. And there's a reason for that. This single movement engages the quadriceps, the glutes, the hips, and the lower back all at once. The entire strength foundation that keeps you steady when you turn, step up a curb, lower yourself onto a toilet seat, or rise from it. Walking simply doesn't load these muscles strongly enough to make them grow. When I teach this exercise, I usually start with something simple. I ask them to choose a sturdy chair about knee height and sit close to the edge with their feet flat on the floor about shoulder width apart. Hands can rest lightly across the chest or on the thighs, but without pushing. Then I show them how to lean forward slightly, press their heels into the ground, and rise over the course of 3 slow seconds. Once standing tall, they hold for a moment, then gently lower themselves back down in another slow 3-second descent just until they touch the seat. Most people begin with 8 to 10 repetitions, rest a minute, and repeat the sequence 2 or 3 times a day. And if someone isn't strong enough in the beginning, it's okay to lightly hold a table or the arm of the chair for support. The goal is to gradually work toward doing the movement without the hands, and something wonderful happens. After about 2 weeks, most of my patients tell me the same thing. Standing up feels easier. They no longer have to heave their body forward. Stepping onto a curb feels more controlled, and their legs simply feel stronger when they walk. No gym, no equipment, just a sturdy chair and 10 to 15 minutes a day. If standing up from a chair already feels difficult for you after 70, this is exactly where you should begin. In the next part, I'll show you a movement that trains your calves to react faster. Something that can protect you from those sudden slips that catch people off guard. And if what I'm sharing is helping you understand why walking alone isn't enough after 70, take 1 second to tap. Like so YouTube knows you want more content about senior health. And if you are over 70, or care for a parent, aunt, or uncle in that age group, subscribe and turn on notifications. Every week, I share safe, simple home exercises that strengthen your bones, build your muscles, and reduce your risk of falling. Now, let's keep going, because the next exercise may be the very reason a tiny stumble will no longer threaten your hip. Exercise number 2, eccentric heel raises, strengthening the calves, preventing falls. If the sit-to-stand is the strength test of old age, then eccentric heel raises are the movement that can quite literally save you from a fall. So many hip fractures I've operated on began with something incredibly small. A slight trip on the edge of a rug, a missed step on a curb, or a minor slip in a grocery store. What determines whether you catch yourself or go straight down isn't luck, it's your calves and your Achilles tendon. I remember David, a 79-year-old patient, telling me, I don't understand how such a tiny stumble sent me falling forward before I could even react. When we tested him, his calves were so weak he couldn't stay on his toes longer than a second or two. And this is extremely common after 70. The calf muscles slowly shrink, the reflexes fade, and ordinary walking simply doesn't provide enough stimulus to keep those muscles strong. Eccentric heel raises focus on the slow lowering phase. That's the part that teaches your muscles and tendons how to brake your body when you slip, misstep, or accelerate too quickly. A major study on muscle and bone health in older adults found that eccentric exercises can increase strength by more than 60% and significantly improve balance when someone is pushed or stumbles unexpectedly. When I teach this movement, I ask patients to stand behind a sturdy chair and rest their hands lightly on the back for support. Feet stay hip-width apart, fully grounded on the floor. Then I guide them to rise slowly onto the balls of their feet, holding at the top for a second or two, before lowering the heels back down over a slow, controlled 3-second descent. I remind them to breathe steadily, look straight ahead, and avoid dropping the head toward the floor. Most begin with 8 to 10 repetitions, rest a minute, and repeat the set 2 or 3 times. And if someone has fallen before or feels anxious, I tell them to stand closer to a wall or keep an extra chair nearby for reassurance. The goal after a few weeks is to reach 15 controlled repetitions per set, and the changes come faster than most people expect. After about 2 weeks, many of my patients tell me they no longer feel that sudden collapse in the calves when stepping off a curb. They feel more confident walking on uneven surfaces, and when they do stumble, their body seems to snap back into balance instead of pitching forward like before. The beauty of this exercise is that it takes only 3 to 5 minutes and fits perfectly right after your sit-to-stand practice. You can do it daily or at least 4 to 5 days a week. And if you've ever had a moment where you almost fell stepping down a stair or slipped slightly in the bathroom, consider eccentric heel raises a non-negotiable exercise after 70. In the next section, I'll show you the step-up, an exercise that not only strengthens your legs but stimulates your hip and thigh bones far more effectively than walking ever could. Exercise number 3. Step-up, climbing a step to strengthen your legs and bones. If you really want to know how strong your legs are after 70, pay attention to how your body feels when you climb a few steps. Many of my patients, like Robert, who is 76, tell me the same thing. I can walk just fine, but after 4 or 5 steps, my thighs shake, I'm out of breath, and I have to grab the handrail. That's a clear sign that the muscles of the thighs and hips, and even the bones themselves, have grown weaker even if they still walk every day. The step-up exercise mimics the exact motion of climbing stairs, but in a slow, controlled, and safe way. Unlike walking on flat ground, this movement places a stronger load on the thigh bones and hip bones and forces the glutes, quads, and stabilizing muscles around the knees to work harder. This is precisely the kind of stimulus your bones need to stop thinning as you age. Studies on osteoporosis in older adults show that weight-bearing exercises, things like stepping onto a platform, doing light squats, or repeated sit-to-stand movements, can improve bone density in the hip and femur and reduce fracture risk. And in my own practice, I've seen patients who consistently train step-ups 3 or 4 times a week walk stairs with far more confidence. They rely less on both hands, feel steadier, and most importantly, they fall less often. When I teach step-ups, I usually begin with a low and sturdy step, something like a doorstep, a wooden platform, or simply the first stair about 4 to 6 inches high. I have them stand facing the step with their feet hip-width apart, and if needed, keep a hand near the wall or railing. Then I ask them to place the entire foot, heel to toe, on the step, never just the front half. From there, they push through the heel rise, up slowly, stand tall for a moment, and then lower the back foot to the ground in a controlled descent before bringing the working foot down. We repeat the movement 8 to 10 times on one side before switching, always breathing steadily and moving deliberately. The slow lowering phase is the most important part because that's when the muscles learn to break the weight of the body, an essential skill for preventing falls. Beginners may start with 5 repetitions per side for 1 or 2 rounds, then increase gradually. After 3 or 4 weeks, the progress becomes obvious. People tell me they no longer worry that their legs will give out on the steps. Their thighs and glutes feel firmer, the trembling eases, and they feel much more stable when stepping over curbs, thresholds, or stair edges. If you've been avoiding stairs because you worry about your legs fatiguing or missing a step, this is the week to begin step-ups on a low platform. In the next section, I'll share the golden key, how to pair these exercises with nutrition and bone assessments so you can truly protect yourself from fractures after 70. Golden key, the 3 pillars that protect your bones and joints. After 70. By now, you've probably realized something important. After 70, walking alone is not enough. But even practicing sit-to-stand heel raises or step-ups isn't the entire solution. To truly protect your bones and joints, you need a trio that works together, almost like the 3 legs of a stool. Remove one leg, and the whole structure becomes unstable. The first pillar is strength training, just 10 to 15 minutes a day. I often tell my patients over 70, from this point on, think of strength training as your daily medication. You don't need heavy weights or a gym membership. You just need consistency. Those 3 core exercises we've covered form the foundation, and when done 4 to 6 days a week, they become surprisingly powerful. Studies in older adults show that increasing lower body strength by 20 to 30% can lower fall risk by as much as 40 to 50%. It's not about how many different exercises you do. It's about showing up week after week. The second pillar is protein, enough of it, and every single day. This is where so many people fall short. You can train diligently, but without adequate protein, your muscles simply don't have the building blocks they need. After 70, your body absorbs protein less efficiently, which means your needs actually increase, not decrease. Aiming for about 1 to 1.2 grams of protein per kilogram of body weight per day is a good target. For someone who weighs 60 kilograms, that's around 60 to 72 grams a day. Good sources include fish eggs, chicken breast, high-protein yogurt or milk beans, soy, and tofu. And spreading that protein across 2 to 3 meals makes it easier for your body to use it. When my patients combine proper strength training with enough protein, they start to feel real power in their legs within 4 to 8 weeks. Not just fatigue, but genuine strength. The third pillar is a DEXA scan every 1 to 2 years, a simple way to map the true condition of your bones. Many people only discover they have osteoporosis after a fracture occurs, and at that point, the window for prevention is already closed. That's why I encourage adults over 65 or 70, especially postmenopausal women, to get a DEXA test. It tells you whether your bones are normal thinning or already osteoporotic. And with that information, your doctor can determine whether training and nutrition are enough or whether you need medical treatment as well. When you put these 3 pieces together, proper strength training, enough protein, and regular bone density monitoring, you dramatically reduce the risk of hip fractures and fall-related injuries. I've seen countless patients in their mid-70s and 80s stay steady on their feet, climb stairs with confidence, and live independently, not because they were lucky, but because they followed this golden trio year after year. So take a moment and reflect, which of these 3 pillars are you already doing well and which one have you been neglecting? Even a small adjustment starting today can give you or your parents a far better chance of avoiding unnecessary surgeries and protecting independence in the years ahead. Conclusion: why walking is no longer enough. After 70, walking is still wonderful after 70, but it's no longer enough to keep your bones, joints, and muscles safe from the risks of falls and fractures. The real key is strengthening the legs, hips, and calves with movements like the sit-to-stand eccentric heel raises and step-ups, paired with adequate daily protein and regular bone density checks. Just 10 to 15 minutes a day can create a dramatic difference. You'll rise from a chair more steadily, step over a curb with more confidence, and sharply reduce the chance of ending up in the hospital because of one small slip in the bathroom. If you're over 70 or caring for a parent or grandparent in this age group, I hope you won't stop at simply walking for activity. Start today with the 3 simple exercises we covered in this video. And if you'd like to stay committed, drop a comment below saying, "I want to keep my bones and joints strong after 70, so I know you're still with me on this journey." Don't forget to like, subscribe, and turn on notifications so you never miss new videos on exercises, nutrition, and fall prevention strategies for older adults. Thank you for staying with me until the end. I'll see you in the next video, where together we'll keep building strength, confidence, and independence for the years ahead.